Huntington's disease, also known as Huntington's chorea, is a neurodegenerative genetic disorder where nerve cells in the brain break down over time. As a result, a person's physical and mental abilities deteriorate. Having Huntington's is like having Alzheimer's, ALS, and Parkinson's all in one. Huntington's is an inherited disorder caused by a defect in a single gene, the Huntington gene on chromosome 4. This defective gene contains a repeating sequence of 3 base pairs. An excess number of CAG repeats in the gene results in a protein containing an excess number of glutamine units. Ultimately, this is toxic to brain cells. The gene for Huntington's is autosomal dominant, so a person only needs one copy of the defective gene to inherit the disorder. In other words, if one parent has it, each of their kids has a 50-50 chance of inheriting it as well. Although Huntington's affects all parts of a person's brain, the basal ganglia region is particularly targeted. This region plays a key role in movement and behavior control. A person with Huntington's usually starts to see their first symptoms in their early 30s or 40s. The first symptoms include loss of balance, trouble swallowing, lack of coordination, and involuntary movements. Difficulty concentrating, memory lapses, depression, mood swings, and clumsiness are also very common. As the disease progresses, uncontrollable movements of the face and jerking, flicking, or fidgety movements of the limbs and body occur more frequently. Cognitive and psychiatric impairment occur as well, and patients often experience depression, OCD, or mania. In late-stage Huntington's, the patient is completely dependent on others to perform daily activities. Here is a video of a 38-year-old man with Huntington's. As you can see, he has completely lost control of his body and movements. There is no cure for Huntington's. Treatments such as drugs, physical therapy, and speech therapy can help manage the symptoms, but it is eventually fatal. As of right now, there is nothing you can do to slow, stop, or reverse the disease's progression. However, medications such as tetrabenazine, also known as xenazine, suppress the involuntary jerking and writhing movements associated with Huntington's disease. Antipsychotic drugs, such as Haldol, can also help suppress movements. Although right now there is no cure for Huntington's, researchers across the country and around the world are working to understand more about the disease and how it affects a person's mind and body, hopefully leading to more medications and treatments in the future.